nurse on this facility. I will be taking care of you today. So, why are you looking so worried? What happened to you? May I know, please? And could I confirm your name too?
A very good morning, Nurse Shweta. Good to know that you are going to attend me this morning. My name is John. I am 55 years old. I'm just doing business. But as of now, I'm not in a mood, to understand what is happening to me. I know that I'm suffering from this end stage renal disease. I'm in the last stage of my life. I know whatever the treatment has been given, I don't have faith in that I could be recovered and I could live long a quality of life. Just for the sake of my family members, I've accepted for this treatment, nurse. I know my health is deteriorating, and I have I don't believe that this treatment is going to help me. So, and moreover, the why the dialysis has been done to me, it is quite awkward. So it is quite awkward. Why don't you stop the dialysis? It's quite awkward and it's quite embarrassing to me.
Of course, I can understand your concern that you are worried about your condition and what will happen to next. So please feel free and don't worry about it all. We are here to solve your problem. If you will not discuss, we can't do it easily. So please tell about what you are feeling fear and embarrassed. Actually, dialysis is must because if we will not do dialysis, you will not be prepared for transplant. Dialysis is a procedure by which we can continue your urination process. So it is more important than accept that another problems we will solve first. First, your medical condition is also to be okay. Then only we can think about transplant. Till that, we have to do dialysis. And donor, for that, uh, uh, donor should be we have to we have to we have to see the donor actually because we have to do test for donor also and blood group and all the things we have to check. And about the yeah, yes, it's little bit awkward, but please don't feel this because health is must. If you will feel fear and embarrassed with this, it could not be help to you for about the come out this problem. So
Well,
it
nurse,
is
I do understand what you come to say, but as a person, I'm 55 years old and I'm in the end stage renal disease. My health is deteriorating. So I know that I'm not going to survive this operation. Anyhow, as I told you, just for the sake of my family members, I've accepted, I have come for this treatment. As I told that we have to wait for the donor, let me know when do we get the donor? Once we get the donor, how long would it take for the kidney transplantation? So how many hours the transplantation could be, and is it a painful experience?
First of all, please don't feel that you will not be okay after this surgery and all. There are so many patients of your age also which got successful transplantation and donor also we already applied and your family is also searching for a donor for same blood group. So it will be happen easily. Don't worry, and surgery will take 5 to 6 hours. And after that, 2 to 3 days, you will feel that something is happened actually. After that, your urination and your dialysis will be stopped. All problems will solve, and within 10 to 12 days, you will you will feel more better more better. You can walk and you can walk and you can take food even after 2 or 3 days
Well,
after
nurse,
the
I'm
surgery.
really thankful for the optimistic, vibe that you are trying to create on me. But I know what is my situation. But one more information I would like to check with you that according to the documents and the policies, I have already nominated not for the resuscitation. Are you aware of it? Hello. Hello.
Hello.
Yeah, I asked you a question that I have nominated not for the resuscitation. Are you aware of it?
Abba.
So you don't have an idea what is that,
Yes, ma'am.
right? So if you don't have an idea, somehow you have to manage. You see, not for resuscitation. Resuscitation is nothing but, see, when they do the kidney transplantation because of age 55 years, chances for the person to get a heart attack. Okay. So what is the
Okay.
responsibility of the medical team to save the life? So in case if the patient gets heart attack, they have to save their life by the resuscitation. Okay.
Okay,
But
ma'am.
the patient says, I have nominated not for it. I don't want to be I don't want the resuscitation to be done to save my life. When it is, when I get heart attack, leave me as it is. That is what he is saying. So for that,
Okay.
how do you speak?
Okay. Yes, I know. Yes, I aware about it also. But don't worry. At the time of surgery or transplantation, all doctors will be there. Transplant surgeon and anesthetist and cardiac doctor also will be available there. They will manage the situation, and if it will happen, they will treat you accordingly, and they will manage the situation. You please don't worry about that.
But nurse, I'm so sorry to say that this is my wish because you have to, respect the individual wish of the patient. And I'm conscious and I'm good at decision making. So this is my wish. I already informed to the doctors and the medical team as well as to the hospital management. So you could follow it. Kindly arrange for the documents, anything to be signed from my side that I'm not for resuscitation. And yes, I think I could directly speak to the doctor to get a clarity on these things. Could you arrange for a meet with the doctor? Thank you.
Okay, surely then we will follow this, and I'll tell to doctor also about it. If there will be any documentation clarification, doctor will tell you about it. He will come after 1 hour, so please wait till that.
Thank you.
Thank you. If you have any doubts, you can ask, and please feel comfortable and free. Thank you.
Yeah, fine. Shweta, so for this particular card, I can give you C plus because to some extent you had spoken what is this end stage renal disease, but the resuscitation point you didn't speak well. And
Yes, ma'am.
also about the donor and dialysis, why the dialysis has been done, clearly you should have spoken. And almost 7 minutes you had taken. Okay, so after
Okay.
5 minutes, any time the examiner would stop you, maximum for time 6 to 8 minutes. So probably if 5 minutes gets over means any time it would have been stopped. Okay.
Okay.
So 6 minutes is the maximum time limit you could keep in mind. You have to come out with better points and almost two important medical information you didn't share it. Also, it is clearly given in your card. Right, the patient told that not for the resuscitation. You have to encourage the patient to take the counseling. You will arrange for the counselor. After speaking to the
Yes, ma'am.
counselor, they get. So that part you have literally missed. Okay.
Yes,
See, first
ma'am.
of all, when the patient says in the beginning that I know that I'm suffering from end stage renal disease, I don't have faith that I could recover from this, I could survive because I'm in the end stage renal disease. My health is deteriorating. Just for the sake of the family members, I've accepted it. And why don't you stop this dialysis? So for that, you have to start encouraging the patient. You have to say that I'm extremely sorry to hear that you don't have faith in this treatment. Don't be reluctant. Kindly cooperate. Actually, you are just 55 years old. Chances for your survival is more. Once the kidney transplantation has been done, definitely another 15 to 20 years you could lead a very quality life. So don't panic on this. This end stage renal disease, the dialysis is mandatory for you because if we stop, because weekly thrice we have to do the dialysis. And so if we stop the dialysis, what could happen? The toxins could have been built up in the blood. Okay, and that could be causing a condition called uremia. So what are you supposed to do? You have to cooperate weekly thrice for the dialysis, as your body is, as you are not able to pass on the urine on your own. That's the reason we have just arranged for the dialysis. If we stop the dialysis as you are already in the end stage renal disease, so I'm so sorry to say that you have to accept the truth. Sometimes it could be fatal. So once the dialysis has been stopped, depends on the health condition, other comorbidities of the patient. Definitely, within 4 5 days or a week, even death is inevitable. So I'm requesting you, please, accept this dialysis. It is mandatory until we do the kidney transplantation for you. That point you have to clearly speak. Okay. And
Okay,
next
ma'am.
to that, as a patient, I asked you that, when do you get the donor, what is the procedure, and how long would it take for the transplantation. For that, you have to encourage, you have to say that, I really appreciate that you are showing some kind of enthusiasm to know about the treatment. Yes, we have to wait for the donor. Obviously, within 1 or 2 days, we get the donor. And once we get the donor, a certain, matching test, test to be done for the donor, like, blood test as well as X-ray to be done. And also we check, the donor who is donating is not having any kind of a chronic disease or and HIV, this kind of. So certain tests would have been done to see that the donor is perfectly all right. So that could probably take 3 to 4 hours. Once the matching test has been done, immediately within a day, the kidney transplantation could be done to you. So maximum 4 or 5 hours, the transplantation could happen. After that, you would be kept under observation for 3 to 4 days. We have to observe you and are you able to pass on the urine? Is the kidney that has been transplanted to you functioning properly in your body? So maximum a week time you would be in the hospital, then you would get discharged. So I kindly request you to cooperate. It is all for your betterment. Definitely you will get a better result that you have to say. Okay. And
Okay,
next
ma'am.
to that, the
Okay.
final question, I told you, I asked you that. I hope you might be knowing that I have nominated not for the resuscitation. And are you aware of it? So for that, you have to say, yes, Mr. John, definitely I know. I have read the documents. I'm aware of that. You have nominated not for the resuscitation. But it is my kind and humble request. You have to understand that the medical team is fighting in order to save the life of the person. And the people generally who are 50 plus, who are undergoing this kind of kidney transplantation, there are chances for them to get the heart attack. So the cardiologist must be available in case if you have the heart attack to resuscitate, to do the resuscitation. So you should accept it because we are fighting only to save your life. If you say that you are not for the resuscitation, which means that you are not interested for the treatment, then the total treatment will be a flop. So I kindly request you to accept this resuscitation. It is to save your life. But in case if you are very firm, if you are not for it, then there are certain hospital policy documents that you have to sign along with your family members. Okay,
Okay, ma'am.
so for that I would be saying that, well, nurse, it is the choice of me. It is my individual decision. You have to respect my opinion. As a patient, I don't want to go for the resuscitation, and I'm ready to sign the documents. And moreover, I want to discuss further with the doctor. And for that, you have to say, sure, I would inform the doctor. And prior to that, we would arrange for a counselor. I think counselor could give you a better counseling about the pros and cons of the total treatment, and you might gain confidence after speaking to the counselor. And after discussing with the counselor, you could confirm your decision whether you are for the resuscitation or not. Accordingly, the documents to be signed from your side, Mr. John. So am I clear to you? So when you say all those things, then I would be saying, yes, okay, you could arrange for the counselor. Also, I want to meet the doctor. Thank you so much, Nurse Shweta. I would get back to you. For that, you have to say, welcome, John. I would get back to you and I would get back to you with the counselor as well as the doctor. Thank you. Until then, you take rest. So this is the way you
Okay,
have to
ma'am.
speak. Okay.
Okay, ma'am.
Because every idea correctly you have to speak. That is very needed. And next to that, the earlier card, pilonidal cyst, total flop. You didn't speak anything well. So
Yes,
only
ma'am.
C, yeah, only C I'm giving. First of all, the patient is suffering from pilonidal cyst. The patient is quite embarrassed, and patient says, I feel disgusting in order to explain what is my situation even to doctors and nurses. And I don't know why I'm affected by this. So for that, you have to start encouraging the patient. You have to say, yes, Sarah, I could understand your emotions. Pilonidal cyst is not something very disgusting or embarrassing the situation, and especially to talk to the doctors and nurses, you should not hesitate. The openly, if you speak, the better the treatment the doctors could give you. And it is nothing but pilonidal cyst. It is a kind of abnormal skin growth that has been located at the tailbone, and that is mainly because of the ingrown hair and the skin that has been covered. So it would have been raised as a pimple or as a boil in between the buttocks. So mostly that is the reason you are finding it disgusting to speak on it, but don't bother. It is a simple procedure. An incision could be done. We remove the cyst. It is not something serious, but the removing the cyst will help you to lead a better life and normal life. Otherwise, the infection, it could form kind of abscess, and sometimes the pus will come out, and sometimes it could bleed. You will get a foul smell. As you are a working person, it is better to remove the cyst. That is why we are preparing for you. So that information you have to give. Okay.
Okay, ma'am.
And then as a patient, I might say that, but nurse, I told you that, I'm a person who is giving more importance to cleanliness. I take twice a day bath, and also I wear neat and clean clothes. It is told that because of non-cleanliness, people might get it because of dirt. So that is why I feel embarrassed to speak on it. For that, you have to say, no, Shweta, I mean, no, Sarah, it is a wrong opinion. It is not because of not only because of cleanliness. See, it depends on the job that you do. If you are sitting and for a prolonged period of time, the sweat that would have been accumulated in between the private part, especially between the buttocks, and that would have resulted in this pilonidal sinus. You might have ignored to clean it properly, so that could be one of the reasons. So don't panic on it, don't bother. It is a small incision we do by removing it, and we just do the antiseptic dressing will be done to you. So always it is quite safe, and so that information you have to give. So for that, I would be repeating that, yes, nurse, I understand what you come to say. My job is, I'm an accountant. I have to sit for 9 to 5, that is more than 8 hours per day. Prolonged sitting, it is to be done by me. Even after a cyst has been removed, this is a job I have to continue. So what could I do not to get it in the future? No, again, I should not get this problem. For that, you have to say, well, it is a very good question, Sarah. As you cannot change your job, but you can incorporate some lifestyle changes. First of all, you see to that every 1 hour you are getting up and doing some kind of bending, stretching, and some kind of simple exercise rather sitting continuously for 7 to 8 hours. And next to that, as you are sitting for a longer period of time, you can use a cushioned chair, rather hard surface. So see to that you are sitting on cushioned surface, and also wear loose fitting clothes. Don't wear tight fitting clothes, loose fitting cotton clothes. So that could bring free air circulation. And moreover, after the cyst has been removed, if you take at least 2 to 3 days bed rest, that could be advisable. In case immediately you are starting your job, you have to see to that you are changing your antiseptic dressing every 3 hours, because sometimes it might bleed, it could be soggy. So if you just remove it, you feel comfortable. So these all the things that you have to adapt. Is it clear to you, Sarah? Then I would be saying, yes, nurse, to some extent I understood what is this pilonidal cyst, how to avoid it in the future. Thank you so much for your concern in order to explain all the things in detail. Okay. And
Okay,
for
ma'am.
that, you have to say that, yes, I have to prepare you for the cyst operation. It is a small incision to be done. So that's the reason I have visited you in order to discuss on it. And so don't panic, have confidence. It is a simple procedure. within 2 to 3 days you would be perfectly all right. But future, you have to follow the do's and don'ts not to get it again. Am I clear to you? If everything is clear, shall I take a lead? So that's it. So this is
Okay.
how, yeah, this is how you have to speak for both the cards.